Did you know that 1 in 7 US adults are affected by chronic kidney disease? Kidney failure can be a silent killer, as many people don't experience symptoms until their kidneys are close to failing. In this video, we'll discuss 5 warning signs of kidney failure and what you can do to keep your kidneys healthy. Metallic taste. If you've ever experienced a metallic or bitter taste in your mouth, it could be a sign of kidney failure. Having a metallic taste is one of the hidden warning signs that could indicate potentially dangerous damage to your kidneys. When the kidneys start to shut down, they are unable to filter out waste byproducts in the urine. Instead, because the kidneys are unable to excrete the waste chemicals, these compounds end up back in the bloodstream. As the waste accumulates, people may experience a metallic taste in their mouths. According to KidneyWise, here is why the metallic taste is particular for kidney diseases. Some studies have found that people with end-stage kidney disease have a reduced flow of saliva, which may be caused by changes in fluid status. This can cause dry mouth, which affects the taste buds. Normal saliva is slightly acidic, but some studies have shown that the saliva of people with end-stage kidney disease is more alkaline, which can affect taste. People with end-stage kidney disease have higher levels of urea in their saliva than those with normal kidney function. This affects the perception of bitter taste, causing either an increase or a decrease in perception of bitter taste. It can also cause a metallic taste. Dry and itchy skin. Another fascinating hidden sign of possible kidney damage and kidney failure may be dry and itchy skin. Forget about allergy season, because the itchiness caused by kidney failure is on an entirely different scale. As the kidneys shut down and the waste products accumulate in the circulation, our skin may also undergo some drastic changes. Scientists believe the high concentration of toxins and wastes can irritate the nerves surrounding the skin, causing itchiness. Along with the urge to scratch the skin, kidney failure can cause dehydration and shrinkage of sweat glands, causing dry and irritated skin. Here is how kidney failure survivors Jen Trunk and Alex Barrios experienced skin changes during their bouts of kidney damage. According to Jen Trunk, "It's like pins and needles inside my skin. Sometimes it will start with a light physical touch and ramp up. I will scratch a little bit, and the tingles will get stronger. Then I'll scratch more, and it just never stops. It's impacted my life greatly, and it's maddening when it happens. It's maddening when it happens. It's impossible to do anything. I've had to pull over on the side of the road while I'm driving because I can't focus. I can't hold conversations once it's started." Alex Barrios also shares his perspective. "Pruritus is an ongoing journey throughout my life with chronic kidney disease. It started in the very beginning, before I even started dialysis. I would notice myself itching on my back, especially, but all over my body. I found that to be pretty puzzling, and it took me some time to figure out what was making me itch. When I finally went into dialysis, I learned that that was one of the symptoms of end-stage kidney disease. That's when I was able to talk to my care team and try to find some type of resolution for this problem." Weight gain and water retention. Unexplained weight gain and water retention can be symptoms of kidney failure. When the kidneys aren't functioning properly, they can't remove excess fluid from the body, leading to swelling in the ankles, feet, or hands. This condition, called edema, can be a sign of kidney disease or kidney failure. When kidneys fail to formulate and excrete urine, the waste product and the excess fluids enter the blood circulation, leading to various complications, including edema. Here's a little experiment you can do at home to check if you have edema. In the earlier stages of kidney failure, when the water retention has just begun, we may experience something called pitting edema. If we were to press down and put pressure on an edematous area, usually your shins or feet, a pit-like dimple would form. Hence, its name, pitting edema. If you notice a dimple, like indentation in your ankles, then chances are you might be experiencing acute kidney failure and should seek immediate medical attention. But what exactly can cause kidney failure that could lead to edema? Kidney failure could stem from various factors, from the most common cause of diabetes to high blood pressure, autoimmune diseases, and even alcohol overuse. Kidney failure is a serious condition that can alter one's life in a matter of seconds. Here is how the National Kidney Foundation defines acute kidney failure. Acute kidney injury, also known as acute renal failure, is a sudden episode of kidney failure or kidney damage that happens within a few hours or a few days. Acute kidney injury causes a buildup of waste products in your blood and makes it hard for your kidneys to keep the right balance of fluid in your body. Acute kidney injury can also affect other organs such as the brain, heart, and lungs. After having acute kidney injury, your chances are higher for other health problems such as kidney disease, stroke, heart disease, or having acute kidney injury again in the future. The chances for developing kidney disease and kidney failure increase every time acute kidney injury occurs. To protect yourself, you should follow up with your healthcare provider to keep track of your kidney function and recovery. Are you finding our video informative? Please consider liking and subscribing to our channel to keep up with our latest health and science findings. Fatigue, poor sleep. If you have just begun experiencing sudden bouts of fatigue or sleeplessness, then keep on watching. Fatigue is one of the leading symptoms of acute kidney damage and kidney failure, and there's an intricate biochemical explanation to this phenomenon. During kidney failure, these essential organs fail to produce a hormone called erythropoietin, or EPO for short. This hormone is responsible for stimulating the bone marrow to produce and release red blood cells. When there is a sudden and significant decrease in erythropoietin, there are fewer circulating red blood cells and, in turn, less oxygen. In other words, anemia starts to develop. With anemia, our brains begin to lack oxygen, which is why you may feel extremely tired, lethargic, or simply sleepy at all times. You may even notice very frequent yawning. According to studies, here is how chronic kidney disease, or CKD, can manifest as fatigue and just how common this one symptom is for kidney failure patients. A 2021 paper reveals it is usually described by patients as extreme and persistent tiredness, weakness, exhaustion, or lack of energy that is out of proportion to their degree of exertion and may interfere with physical functioning. Approximately 70% of patients with chronic kidney disease report fatigue, up to 25% reporting severe symptoms. Patient-reported fatigue is associated with death, dialysis initiation, and hospitalization among individuals with chronic kidney disease. Changes in urine. Finally, for many people, changes in urine can often serve as a signal that something might not be right with the kidneys or the urinary system. Pay extra attention to your urine if you begin to experience the following signs and symptoms: urine color changes, pain while urinating, blood in urine, or the appearance of cloudy or foamy urine. Some may also experience decreased urine output or the urge to urinate more often. According to the National Kidney Foundation, here is why we may exhibit changes in our urine during kidney failure or kidney damage. Healthy kidneys typically keep the blood cells in the body when filtering wastes from the blood to create urine. But when the kidney's filters have been damaged, these blood cells can start to leak out into the urine. In addition to signaling kidney disease, blood in the urine can be indicative of tumors, kidney stones, or an infection. Excessive bubbles in the urine, especially those that require you to flush several times before they go away, indicate protein in the urine. This foam may look like the foam you see when scrambling eggs, as the common protein found in urine, albumin, is the same protein that is found in eggs. So, to make it all clear, here are the signs you should look out for in your urine if you suspect you might have chronic kidney disease. Color changes. Urine may appear dark, brown, or red due to the presence of blood. This could indicate kidney damage. Foamy urine. Excessive bubbles or foam in the urine can signify protein albumin in the urine, which points to damaged kidney filters. Decreased output. Producing less urine than normal or having difficulty urinating could mean improper fluid filtering by the kidneys. Urgency and frequency. Feeling a sudden urge to urinate more often, especially at night, may result from improper fluid regulation by the kidneys. Pain or burning. Experiencing pain, discomfort, or burning sensation while urinating can indicate an infection or inflammation in the urinary tract due to kidney dysfunction. Blood or pus, pink, red or brown urine could contain blood cells or pus, signaling kidney infection, stones, or even cancer. If you find yourself experiencing a metallic taste in your mouth, dry and itchy skin, weight gain and water retention, insomnia and poor sleep, or even changes in your urine, then it might be time to contact your doctors and seek immediate medical care for a possible kidney failure. Thanks for watching. If this video was helpful to you at all, could you do us a favor? It would be a really big help if you subscribe to our channel and shared this video to someone else that might enjoy it. As always, leave your suggestions for new videos in the comments below, and we'll see you in the next one.